Do we have good study to support that stress causes heart disease? No, no. We blame stress on everything. Right? That's true. What else? Somebody mentioned physical activity, lack of physical activity. Absolutely. And that is the major determinant. I went to a conference in, it's going to sound pretty, anyways, it was a very good conference, and you won't believe me now, but in Paris over March break. It happened to be in Paris, and it happened to be over March break, I swear. And it was about exercise and heart. And in France, there was the Société de Cardiologie de France, there was 400 people there on this 3-day conference that had nothing but heart disease or heart wellness or heart disease and physical activity. And you know what? They walk so much, the Parisians. They walk up and down. If you've been, I mean, anywhere in Europe, I guess that's the same with Italy, but they walk up and down. The metros are just mazes, and you walk for kilometers. They all have very good shoes, very good quality shoes, and they're all lean. And a lot of them smoke. But they still have less heart disease than we do. So moving is very important. So we talk about diet, of course, low fat, high fiber. That's, that's very good. Are we restoring life to this? It's on life support? Yeah. All right. So it's kind of rearranged for this. We just timed it just so that it would die during the talk. What's not modifiable? What are risk factors that we can't change? Genetic, yes. So you can't choose your parents, we say. And some would say you can't choose your kids. Or they can't choose us. So genetics, it accounts for how much of your risk you think genetics. Oh, heart disease is in my family. It's bound that I'll have heart disease at some point. Is that right? No. It accounts for 10%. Now, the trouble is cholesterol. Good part of that is often genetic, too. High blood pressure, I'll show you if we ever have slides. 50% of us at least develop high blood pressure. So we end up at risk. So the modifiable, we can do something about. Now, what happens if are we alive? No. Oh, it's too bad. I want to show you this. All right. If I have high blood pressure alone, it increases my risk by 2.5 times. Okay? If I was going to let you guess. That's why I had a... if I have high cholesterol, it increases my risk by 3, times 3. If I smoke, it increases my risk times 3. If I smoke and I have high cholesterol, it increases my risk by 7 times. If I have high blood pressure and I smoke, it increases my risk by, I can't quite see it, by 5. And if I have all 3, take a guess. 11. So they add up. They don't just add up, they potentialize each other. It's thinking, yeah, that's fine. That's what we're chatting. We're having fun. So risk factors are interdependent. And as we know, as we talked about already, if you lose 5 pounds, and already all the risk factors go down. Blood pressure is better controlled. I mean, you just have to lose even just 5%. 5 to 10% of your weight if you're overweight, and already that's enough to control the risk factors. Obesity, of course, that's always often accompanied by, as you gain weight, blood pressure goes up, diabetes occur or pre-diabetes, triglycerides go up. Again, with fat around the tummy, triglycerides are the ones that tend to increase the most. And the good cholesterol, do you know what it's called, the good cholesterol? Wow. This is a very well-informed crowd. I don't know what I'm doing here. I'm just having fun, but I'm happy to be part of it. So the HDL, that's what goes up is a good thing when the HDL, the good cholesterol, goes up with exercise, and it goes down with obesity. Blood sugar control also is improved, and the lipids as well. Do you know what lipids are? Cholesterol. So that's why, you know, you might, I don't know, if you're seen by a doctor at some point, and they might ask you, do you have hyperlipidemia? And you feel like saying, can you please speak English? Hey? So, and what do you do when you don't understand what they say? Does everybody ask? You have to. You should. Absolutely. And we're thinking we're further. All right. I'm afraid I'll be disorganized when we get to power. All right. So what's different about women, you think? What have you concluded that is different with women and heart disease? Different than men? See? Yes, yes. So yeah, we have hormones that they don't have, or we're supposed to have more. Yes, or not the same type. Yes. What else? What is different in the heart disease part? The symptoms. What do we know about the symptoms? Totally different? Are they always totally different? Sometimes, yes. Sometimes. I'd say rarely to not frequent, except they're often considered not atypical, what we call atypical. That's a very nice picture. So the symptoms, so we'll go back to that, yes. What else is different with women? You said it in the question. How about when we get help? When do we decide to call the help button? We delay it. Why do we delay it? Yeah, we can't believe we're having a heart attack. We don't have time, frankly, because I got this and that to do. This can't be that, right? And we problem solve for everybody, so we're going to problem solve for us. Now, if someone thinks that their husband is having a heart attack, what does the woman do? 911, you don't have a phone that can dial fast enough, right? But for us, a bit different. What else might be different with women? Do you think we respond the same when we're asked in the emergency room, for example? So, madame, what are you here for today? Do you think we tend to say, I have, you know, severe pain here that I feel in my shoulder that goes to my arm. It happens when I'm walking. It goes away when I stop walking. It started a week ago. I used to have it once a day. Now I have it 5 times a day. And this morning I woke up with pain. Do you think we tend to do that? No. What do we do? Well, it's not that bad. I mean, I feel it right now, but... Right, right. So, but it's a funny thing, like men that know nothing about medicine will often give us such a story that is pretty classical. I mean, my 14-year-old would have read this in a book, learned this on a health class, and would recognize those symptoms. Anybody would. But we might have more kind of indigestion, and we self-diagnose, don't we? Oh, yeah. So I've had this before. I had heartburn the last time. This time it's not going away with Tums. But I think I'm stressed, really. I didn't sleep very much because my daughter got married, you know, on Saturday. And, well, Joe, my husband, is having hip surgery. And, you know, I'm really stressed, so that's probably stress. Whereas if Joe was having that, I'd say, Joe, let's go to the emergency room. So the interpretation and certainly the way that we discuss with the doctors are what's going on. Thank you very much. You have an advance on. Why is it? Okay. Well, no, there's no screen here. The screen here has disappeared. All right. It's not meant to be. I'll go back at the beginning then. All right. I'll go back to this. Are you dizzy yet? All right. We talked about the modifiable risk factors. Diabetes. I put it in yellow because how important it is. Cholesterol, hyperlipidemia, hypertension, cigarette smoking, abdominal obesity, physical inactivity, stress, and estrogen changes with menopause. Non-modifiable, of course, the age. That's the other thing. No matter how much we'd like to modify it, we can't. And what's a family history? What's the genetic? When does it matter that I have a family history of heart disease? If there's a man in my family, first-degree relative, that has had diagnosed heart disease before age of 55, and if there's a woman who's a first-degree relative who's had heart disease before 65. So that's premature heart disease. And this is what I was telling you about. So the risk factors multiply each other's effect. And this we talked about. So this is the number of risk factors, and I wish I could have a pointer. At the top, you see the number of risk factors that we talked about. And you see this is from the Canadian Heart Health Surveys, and this is, it dates a little bit now. It's even worse. But about 3% of women back in 1992 or in the early 90s and late 80s, 3% of women women over 55, over 55, sorry, had no risk factors for coronary disease. And it goes all the way to 47% that have between 3 and 5 risk factors. So I might be a bit overweight. I have high blood pressure, diabetes, cholesterol, and I smoke. That's not uncommon in a woman to have all this, in anybody to have all this. So we were talking about what's so different about women and heart. The persistent lack of awareness. Now, I'm preaching to the converted. My struggle is how do we reach women who don't know? You're here because you want to know more, and obviously you know a lot. So you're interested, and you're going to share this knowledge with everybody in your life, right? Whoever is not here, that's part of your life, is going to know about this. How do we reach the woman who doesn't know and who doesn't know that she doesn't know? And there's a lot to do there. And this is where organizations such as the DIVA Foundation does phenomenal work and can do more as the numbers grow. So that's very good. We'll see numbers on awareness. We talked a little bit about the presentation and the symptoms. We'll go back to that. The different way to communicate the symptoms. Women tend to depreciate their symptoms, or, we don't want to ring alarm bells. We don't want to fuss around us. Is that true? Yeah. And that's not good. I have a problem. Might be my stomach. It might just be heartburn, but I should go and find out what it is to look into it. Belief systems and coping strategies. That's where I put this, the slide or the question in the quiz about vitamins. There is, I'll show you again, I'll show you data of how a lot of women